Good afternoon, everyone, and thank you for joining for this media briefing. Prime Minister, the Honorable Mia Amor Mottley, will address the country on a number of issues at this time before opening for questions. We're also joined by the Attorney General and Minister of Legal Affairs, the Honorable Dale Marshall, and the National COVID-19 Public Advisor, Mr. David Ellis. The Prime Minister will now speak to the country.
I want to thank you for the brief introduction. Good afternoon, Barbadians. Good afternoon, all those who are here with us in Barbados. I indicated to you on the last occasion on which we spoke that I would be making an announcement very soon, and I want to contextualize it. Over the course of the last 2 weeks in particular, we picked up a very clear trend that would have us seeing a number of families across Barbados being affected by this latest variant of COVID, the Delta variant. And we indicated that this was nothing to be trifled with. Indeed, the numbers show that since the 1st of September to yesterday, 84 families in our country have been affected, with numbers ranging from as low as 2 to as high as 8. In the circumstances, we felt that there has to be an approach that refines our capacity to have a whole-of-nation approach and to be able to reach Barbadians irrespective of where they are. We recognize that not everybody watches television, and not everybody reads the newspaper, and not everybody listens to radio. But we have to reach everyone, and we also have to change our behavior in terms of how we relate to each other, particularly those with whom we are most comfortable and see most often. And that sense of knowledge and awareness needs now to inform all of our actions if we are going to not. Indeed, the numbers show. I'm sorry for that interruption. It seems as though one of the media has just come into the press conference. Please mute all of them, please. Thank you. It is absolutely clear, therefore, that we get to the task of helping and finding Barbadians wherever they exist and live in order to be able to change the narrative and to change the behavior. We are satisfied that we've started on this process, but we believe that wherever we can have additional assistance and additional allies in this battle, that we should take them on board. I'm happy to announce that after some level of discussions that we have, over the course of the last few days, settled with the appointment of a COVID public advisor. Many of you would have remembered that we started this battle with Azar, and that we felt that that aspect of behavior modification was absolutely necessary. I think we've changed the name to reflect the fact that we want to reinforce that the person who we are appointing doesn't only have a duty to government, but more importantly, a duty to the public, and to be able to speak to the public. It is against that backdrop that one of the most important aspects for us as a government was to find someone who was independent and who therefore could reach all of Barbados with respect to the information and the advice that would have to be rendered as government's public advisor. On COVID's public advisor, sorry. We have now settled that, and we believe that the person who we are appointing can more than do the job and comes with a long and strong track record of being independent, of being able to speak with Barbadians, and of being able to work alongside Barbadians to help us with the behavior modification. The information is a lot. I shared with you just now how 84 families across this country have been affected. I also want you to know that aspects of some of what we're doing, yes, remain constant in terms of what protects you. You know the drill by now: the physical distancing, the hand sanitizing, the mask, and of course the vaccines, which give significant protection. And the evidence of the protection of the vaccine is seen only with respect seen more and more with respect to the number of cases that we have in our facilities, of whom 80% or more are unvaccinated, And with respect to, regrettably, the deaths that we've had, the 5 deaths that we've had in the last few weeks, all of them are unvaccinated. The conversations have to continue. We have said that we will not mandate adults to take it, but we recognize that there will be consequences, not just in terms of the public health virus, but also in terms of travel and interaction and with the schools. I've made it absolutely clear over and over that we are not changing our approach to vaccinations in schools, but that we have clear exemptions available to us with respect to religious exemptions and with respect to medical reasons that the Ministries of Health and Education will coordinate under the law to give the responses as necessary. Against the backdrop, therefore, of where we are today, we could be a lot worse, but we could be a lot better. We feel that Barbadians have an opportunity still to be able to help us in this battle by helping themselves first and foremost. Indeed, I want to salute today Dr. Corey Ford, who gave, in my view, perhaps one of the best interviews and statements that I've seen since we've started this battle on COVID last night. And I would like to urge those Barbadians who have not yet seen this interview on one-on-one last night with Dr. Ford to make an effort to either get it from YouTube, or I'm asking CBC, if you repeat it every night, Bajans, I believe, would understand that this is our business, because we need as many Barbadians to hear exactly what is happening and with the sincerity with which he has described it. Having said all of that, therefore, I come now to the announcement. It is my distinct honor to report that after these extensive discussions, Mr. David Ellis has agreed to be appointed as government's public advisor, COVID public advisor, but with a responsibility not to government, but to the public of Barbados. It is absolutely critical that that be the remit, because we need all Barbadians, irrespective of who you are and where you live and what you do, to be on board in fighting this battle against COVID. I've asked Mr. Ellis to join us this afternoon, and I'd like to allow him now to take the floor, and I'll come back at the end, and then we'll do questions after. In addition to the Attorney General, Minister Bostic is also with us, so that we look forward to the engagement as we continue in this battle to wrestle COVID-19 to the ground in terms of its ability, 1, to be able to cause deaths, and 2, serious hospitalizations, because those are the strategic objectives we set in our mission over and over in the last few weeks. Thank you very much. David?
Thank you very much, Prime Minister and fellow Barbadians and members of the press corps. Let me begin by saying what a difficult decision this has been for me to make. And I was back and forth on it, but the principal reason why I took it was because of the state of the game as it relates to COVID in this country at the moment. I want to begin by saying to Barbadians that we have done a good job. Yes, together there are many people in this country who have done what was required of them. The real variable in all of this has been the Delta variant, and people at times have come to conclusions that are not necessarily correct in that regard. We're not here to beat you about your head. We're not here to blame you, but to encourage those of you who are hesitant and uncertain that we want to work with you towards the goal of trying to minimize the damage that can be done by COVID. And that I see as a critical part of my remit, to reach out to various groups in this country, to hear from you, to get your ideas, to correct the things that you believe are wrong. I know that there's been a lot of discussion about the flow of information. And therefore, I want to work not only with you, but with the organs of government in trying to get the things that we consider to be wrong, right, and those that have been right, to improve upon them. And therefore, I look forward to working with all the interest groups in this country. We have to go into every nook and cranny, and in particular, people who are vaccine hesitant, because I do not believe that we should put so-called anti-vaxxers in the group of people who are hesitant. Those people, we may have to go the extra mile in telling you why you don't need to be as hesitant. And all of this we'll be working on, and I am looking forward to your cooperation as we move forward. I haven't taken this assignment as a partisan job. And to demonstrate that to you, just days ago, I picked up the phone and I called the Bishop Joseph Adderley, the leader of the opposition in Parliament, and then I called Ms. Verla de Pisa of the Democratic Labour Party. Because I've worked with them in the position that I've held before, I said to them that out of courtesy and respect, I thought that they should be informed that I was taking up this assignment. And I am available to assist them and their organizations in whatever way this office can in trying to avoid the kind of difficulties that we are seeing in other Caribbean countries at the moment. So I look forward to working with everybody. We may not necessarily agree on everything, but I certainly hope that we will have the kind of relationship that will take us forward in the fight against COVID-19. Thank you, Prime Minister.
Thank you very much, David. I also want to report that this morning I would have met with, in a teleconference with the President of Cuba, and thereafter we also met with the heads of government of CARICOM. The first one relates to the fact that we will lose some of the nurses next week, going back on holiday. They have been here for a year and they're due for vacation, and we will have some come in to replace them. I'm also in discussions with the President of Ghana with respect to additional nurses. And at the CARICOM level, I think we've all agreed, and I'm sure that the chair of CARICOM will be speaking to the region later, but we've all agreed for deeper cooperation where possible, particularly given the fact that many, all of us effectively, are facing challenges with the COVID variant as we go forward. And all of us are also hoping to be able to see how we can reach out in addition to the Caribbean diaspora, because we have a lot of medical officials who live and professionals and nurses who live overseas, but who may want to come home for short periods of time to be able to assist as the region goes through this surge that we are confronting. I hope also that the message goes home that we are changing the manner in which we are delivering most of our vaccinations over the course of the last few days. I think Barbadians would have seen the tremendous success that we are having with the community vaccination program. In fact, yesterday I was deeply touched by the fact that even though the rain was falling, people just pulled out their umbrellas and remained because they were adamant that they wanted to be vaccinated before leaving the particular site. And as I moved around, the message was very, very clear. As a result, we've asked the officials to increase the number of community vaccination sites per day from 2 to 5 to 6, and to reduce the number of mainstream ones correspondingly. I'm also meeting this evening with the public health nurses in order to be able to get a better grip with what and how we deliver and when we deliver, and I look forward to that meeting this evening as we go forward. So my friends, I ask all Barbadians to stay tuned and to be aware of when the community vaccination program is hitting your community, and to recognize that we are in a race, yes, against Delta that is bolstered by the high transmissibility, and therefore in many instances we do not have the luxury of time. We do not have the luxury of time to protect our families, our loved ones. You have heard me repeat over and over that in the words of Pope Francis, a vaccination is an act of love, first self-love, but it is also an act of love for those with whom we live, with whom we work, and with whom we interact. And this is a national approach that we want all persons to be undertaking at this point. At this stage, I think we can pause and take questions from the media and to get a better sense of what is on people's minds. Thank you, Lisa.
Thank you, Prime Minister. As we open for questions, I'll just ask members of the media to identify themselves and the media houses that they represent before posing their questions. And just to remind you that the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, is also present. Are there any questions?
Good afternoon, Prime Minister. Barry Allen here, excuse me, from the Nation newspaper. In recent days, the Chief Medical Officer and the head of the monitoring unit have both spoken about a current situation where there are under serious challenges in terms of resources. Can you say if at this stage government is in a position to increase resources for both the monitoring unit and the Ministry of Health and Wellness to put more people on the ground, get more people working, especially as we try to fight the current surge in cases we've been seeing?
I'm not sure what comments you're referring to, so perhaps you need to tell me what resources are short. Suffice it to say that at no stage since we have come to government has my Ministry of Finance ever refused a request from the Ministry of Health for resources. The Minister of Health is here, and I'll pass it on to him so that he can confirm that once they have come to us, whether it is personnel or money, we have responded with dispatch. So I'm not sure. There's a lot of conversations going on. I wouldn't mind being part of them.
Thank you, Prime Minister. Good afternoon, all. Let me reassure you, Barry, and the public that we do not have a resource problem at this point in time in relation to our fight against COVID. Yes, we've had challenges, no doubt about that, but that's the nature of the war. What we are doing at the moment is to rationalizing our operations to see if we are effectively utilizing the resources that we have at the moment and also improving in the area of technology. I can assure you that if I need additional numbers, I will get them once I put the case to the Ministry of Finance. But at this point in time, we are not worried about resources except for the fact that the nurses and the medical, clinical side of it, like all other countries, given the number of positive cases and sick persons that we've been seeing, that is challenging at the moment, but we are still managing. Thank you.
Barry, did you have a follow-up?
I do have a follow-up for Mr. Ellis.
Go ahead.
First, congratulations, Mr. Ellis. You spoke broadly about your remit and some of the things you will have to do. But at this early stage in the game, what do you think is your most important task right now?
Well, I think the most important task of all has to be one of trying to deal with the fact that we have so many people out there who are unvaccinated and who need to be convinced that it is important and necessary. I think that it is not just a question of vaccination, but we are expected to follow the protocols as well. I think the message has got to be a combination of those, and that would be priority number one. There is another initiative which the Prime Minister has alluded to, and she would be the one to go into more detail on that if she so desires. But to me, those are the two priority areas right now. We also have to look basically at this whole question of how are we going to change behavior. And the changing of behavior is both immediate and long term, because we need to come to a realization that we have been tricked by COVID time and time again. Last year, this time, we didn't expect to be here. And next year, this time, we don't know where it is going to take us. So we've got to start planning for the medium to long term with this particular disease.
Next question.
Ryan Broom, CBC News. Question is from Minister Bostic. Just trying to find out what's the latest in terms of the variants, the new variant in particular. Has that been detected in Barbados as yet?
Not as yet, but I will say this. Mu is considered as a variant of interest, whereas Delta and Alpha, both of which are here, are variants of concern. So I'm just trying to say to you that right now the fight is against Delta in this country.
If I may add to Ryan, I think that CARFA would have advised us this morning that Mu is, they were seeing a virus that they could not initially identify at first. And of course, once PAHO came out and said that it was Mu, that in truth and in fact, it has been in the region since June. So, and we may well have it in Barbados. We just don't have the confirmation yet. So I want Jeffrey's answer to be contextualized, because against the backdrop of which CARFA spoke this morning, when they meet with the labs, they may well find now that where you saw unidentified, and the reports would say unidentified, the assumption was that it was Delta all along. But they may well have to refine those assertions, so we may well have it. We don't know. Okay.
Good afternoon, Carol Thompson from Starcom Network. I want to go back to the whole question of resources. Prime Minister would have mentioned some of the Cuban nurses are due to head back. Based on the numbers that we've been having, are we looking at getting any, well, we are looking at getting more nurses, but how soon will those nurses be in Barbados? Do you have a timeline for that?
Anticipate that some of the nurses that will go back to Cuba, that they'll send some when the plane comes down. We just don't have the exact number. We know it will be at least 10. We also anticipated, as I said, that we are working with Ghana and expect to hear back from the Ghanaians shortly. And when I go to the UN General Assembly, I'm to meet also with the President of Ghana early next week again. And we hope that we can do the outreach to Barbadian medical and nursing personnel, as I said, in the diaspora. I know, for example, Dr. Ford has already been speaking to 1 or 2 doctors to come in and do locums, including his mentor, so that this is an ongoing process. And it's going to be difficult because everybody is having challenges, but it is not impossible. And in a sense, that's why I'm also speaking through you to the Barbadian diaspora. We are hoping that we can have sessions with them in North America and in the UK to see some of whom may be willing to come home and spend a few weeks and also help as well. And when I meet with the other nurses this evening, we'll raise it again, and those outside of the Queen Elizabeth Hospital, because the principle is we cannot in any way take away from the QEH, because we have other health problems in the country, and the government does not want those persons who depend on the QEH affected by it. So what we're trying to do is therefore have a call outside of the Queen Elizabeth Hospital campus, even though the QEH is the entity responsible for Harrison's Point and all of the other hospitals. Leave Martindale's Road intact and find the additional ones to deal with that there. We're satisfied as well that with the additional persons, and if you heard Dr. Ford last night, he would have told you that he would have trained over 200 people to do some of the various tasks that can help us in these surges. And I have full and complete confidence in all of the doctors at Harrison's Point that we have as to how they believe they can manage by expanding the training available to persons within their employ.
Carol, did you have a follow-up?
Yes, for Minister Bostic. Can you give us an idea of, as we see numbers rising, any new clusters that you've discovered? Have you?
I can tell you for sure that there, as I've indicated before, obviously with the Delta variant we have, and we have said so before, that we have community transmission. So we have cases springing up across the country. There are a number of new clusters, quite a few family clusters, for example. Today alone, we have 8 family clusters from the results from yesterday, comprising between 2 to 7 persons. And between the 1st of September and today, I believe there are about 83 family clusters ranging from 2 to 8? 84, 2 to 8 persons. And so you can see that it is widespread, and we've also had some other clusters in the commercial sector of the country. But there are quite a few, quite a few.
Next question.
I have a question.
Ms. Ron Robinson from Capital Media. Of those 84 families affected by the Delta variant, what are the numbers like in terms of those who have been vaccinated? Would you have that information?
I can tell you that the vast majority, regrettably, have not been vaccinated, and I mean the vast majority.
I add here, however which way we slice this thing, however which way you look at it, it is not changing the reality. The majority of people who have COVID now and are catching it and transmitting it, are getting seriously ill and are dying, are unvaccinated. In Barbados, in the Caribbean, in the North Atlantic countries, in Africa, in Asia, in this world called Earth, the bottom line is the majority. I have said over and over, I am a Jimmy Cliff girl. So unlike others, I will not tire of trying and trying and trying until we succeed. And that is exactly what we're doing. And we're not just doing it here on audiovisual methods through the internet. We're doing it on the ground. We're doing it in small groups. We've asked the churches, we've asked other groups, we're reaching out to others. I've met with sectoral interests, and we'll continue to do so. Because the truth, bald truth, who can protect you against Delta? You. How you act, how you wear your mask, how you wash your hands, where you stand in relation to other people, and ultimately if you're vaccinated, because that then gives your body the capacity to fight it off and to prevent death as much and to prevent as much serious hospitalization as possible. So this battle is now located in you. Each of us right now has to take responsibility for our own safety. And that is why we're talking with people rather than seeking to have a heavy-handed approach, as you heard from Mr. Ellis.
I know someone else was trying to get in just now. I'm not sure who it was.
Ellis, question for Mr. Ellis. First of all, congratulations. In your observation up until now, in your previous capacity, have you noticed a particular age range? You mentioned hesitancy. Have you noticed a particular age range where that hesitancy is taking place? And what would be your approach if you have noticed that in terms of tackling that particular age group?
I think basically this is a matter that we really need the numbers before us rather than to operate on the basis of hunch. So even my own observation would be inadequate in trying to tackle this particular matter. What worries me is that there are a lot of younger people in the country who seem to believe that they cannot be touched. I think in the early stages of the disease, there was this message that young people were better protected. And while in the main that is so, the Delta variant has been making a difference. If you look at what's been happening in other Caribbean countries, we are seeing young people, 18 and 15, and in Barbados, I am sure we must have some kind of statistics that indicate to us what is happening there. What I believe we need to do is to share that information with the public as best as we can, because we have to jolt a number of people out of the sense of complacency that exists. You know, we are crisis-driven people, Ryan, and you know, when the numbers start going up, people start dying, then you will see a different response. But we really shouldn't be waiting until that happens. So we have to use the available information now to get people to become aware. The boys on the block who are out there believing that they too are untouchable when it comes to COVID. So right across the board, we know certain pockets, but we are also conscious of the fact that we have to do more serious studies so that we can use those studies to be in a better position to understand the numbers and also to understand what is motivating them.
If I may add to Ryan, and perhaps this is the context that David will have access to very shortly. Since the 1st of September, over 200 of our young people under 18 have caught COVID. 200 young people. In yesterday's numbers, 30% of the persons turning positive were under 18. The day before, 25%. Let us get real. If the Delta is highly transmissible and young people can catch it, and young people are not vaccinated, they will catch it and they will also help spread it. And to that extent, that is why we are saying that we need more persons. Between the age groups of 12 to 18, we've had 5,500 odd persons vaccinate, which is roughly now just about 27-28% of the age cohort, just under 30%. We need to do better. On Saturday, you heard me say that we're giving ourselves the next 4 weeks to be able to ensure that we can do so. We have still another 26,000 persons that can be vaccinated with Pfizer, and we would want a lot of that to be our young people because of the nature of the fact that Pfizer is the only one of the three that we apply for 12 to 18-year-olds. We've been in discussions all day, as I said, our international partners with CARICOM, with the United States ambassadors across the region and persons from State Department, as well as with the British, to begin to identify when are the other opportunities for delivery of vaccines. Jamaica has had already to suspend further first doses of Pfizer until we can get clarity as to when we will be receiving again. So believe you me, this battle is for our future as well as anything else, and I appeal now to all parents, to all aunts and uncles, to all godparents, to all grandparents, to all neighbors, to all teachers. Let us ensure that those who are 12 to 18 as far as possible are vaccinated, and equally until such time as there is a vaccine for toddlers to 12, then let us make sure that those adults among us, the older people, that we take the vaccine to protect those who cannot protect themselves. That is the Bajan way. That is the way. And I would be happy if we could get rid of those 26,000 Pfizers in less than 2 weeks. That's the truth. I would be happy if we could get rid of it in 1 week. If the demand is there, come forward. We also have AstraZeneca, and that's why I'm saying that some of the older personnel can easily take the AstraZeneca, so we have enough of that, we have enough of Sinopharm, that we can keep going. But I'm asking Barbadians to meet us here. We're not mandating for adults, but we know for children, they need to be protected in schools just because of how they socialize. Thank you.
Are there any further questions?
Prime Minister, is it your hope that the heads of government meetings can come up with a regional framework to do this, or will this be more information sharing in terms of how each jurisdiction is going to be tackling this community spread and the Delta virus?
I think we all agreed that there are some things which we can do well together. We need common communication strategy and common messaging. All of us have suffered from the fake news on social media. We've said it over, and I'll repeat it again because it bears repetition. 2/3 of the fake news and anti-vaccination posts on social media have come from 12 persons globally. 2/3 of it. Let's get real. And to that extent, therefore, we're asking people to trust the sources of information that they're getting information from. At the end of the day, get a pain in your belly, Barry, and where you going? You're going to the doctor. You're going to the pharmacy. And this is no different. They tell me that there are people who don't know what Pfizer is, but I'm told that you all men know Pfizer very, 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 very well, and you don't ask the questions, but what else Pfizer makes. And similarly, there are other areas where we immediately trust our medical professionals, our pharmacists, and our nurses. And I'd like us to do that to get out of this. How many more must die? How many more, in the words of John King, must die before we recognize that the persons who are at risk most now in this country are the unvaccinated, as they are globally?
Follow-up question for Minister Baltic. Sir, can you tell us at this early stage what has been the response to public health personnel going into Barbadian communities and asking people to come forward and either get tested to know their status or to be vaccinated? Is there any movement yet in the direction that you would want to see when you go into these densely populated parts of Barbados?
Very much the answer is yes. There's a lot of movement. In fact, we are very, very happy at the Ministry of Health because this is the best response that we have seen so far for persons to come forward to be tested. And we would have done several communities, in some cases in excess of 200 persons turned out. We picked up some positives, and these communities are in the country and also in the St. Michael area, and we will continue with that until we are satisfied that things are at the level that we are happy with. So yes, it is going very well. We will continue with it, and the response has been great, and I would like to encourage persons and communities to really continue to cooperate with us. And I want to thank especially the district emergency organizations because they've been playing a role in helping to get people to come out, and hope that this will continue as well.
Next question.
Yes, Meshran Robinson here from Capital Media again. This is regarding vaccine hesitancy. There was a belief that not enough information and education was forthcoming, to have people make informed decisions on being vaccinated. So to Mr. Ellis, what will you be doing differently to ensure that information is readily available?
Well, one of the things that has occurred to me is that if we have been so encouraged by taking the vaccines into the communities, it may be useful to take some counselors into the communities as well. So you vaccinate some and you talk to some. Because obviously this thing is working. But that's only one solution. We have got to study this a little bit more. And that's why from the very beginning we talked about behavioral change. And that means we have to bring behavioral specialists to the table as well. So it's a combination of surveys, behavioral specialists working with us, and then the messaging, and trying to make sure that that message is known right across the board and that there is no conflict.
If there are no further questions at this time, I will ask the Prime Minister to give closing comments.
I was just waiting for anybody to put up their hand before we wrap up. Any further, or this is it?
It appears this is it.
Okay. I don't know that everything I'm going to say now is to repeat. Barbadians, this is our moment in time to be able to protect ourselves, to protect our families, to protect our communities. We have done all of the things that we can do at a policy level. We've broadened the tent. We've included the leader of the opposition and the leader of the Democratic Labour Party in social partnership consultations where necessary. In the appointment of Mr. Ellis as the public advisor, we are showing and very clearly that we want an independent voice going to the rest of the country. We are also at the same time recognizing that the battle is with that each and every individual. And we ask you therefore, if you have heard this press briefing, if you have heard Dr. Ford, if you have heard, please spread it to your neighbors. Please spread it to the rest of your family. Please have the discussions with your children. Please have the discussions with your church members. Please have the discussions with the fellas you play football with. I am pleased that I've seen a difference, believe you me, in the last week, 10 days, in terms of people coming forward. But this is not the time for us to drop the baton. We have to continue doing it. As you've heard me say over and over, this is a marathon, not a sprint. You heard Mr. Ellis talk about the medium to long-term initiatives that have to be put in place. And I therefore ask us, please, carry the message and get on board, because I know in my soul of soul that Barbados can win this battle without us having to be draconian or to literally put measures in place that are mandatory and that give people little opportunity. We know that there will always be a few who will not take it, but in this society, the majority have always acted to protect the whole. I hope that the Attorney General, through the Commissioner of Police, will also allow me to have an engagement with the security forces, the police in particular, before long, as I've been doing with the health sector officials, because it is important that we give all of you who need information the information such that we can make sure you protect yourselves. So with those few words, we'll continue to talk with you regularly and continue to ask you to get on board or bring others on board. And as I said on Saturday, the mantra ought to be each one reach one. If each of us reaches somebody else, yesterday in the line, that's exactly what I saw. People going in and saying, look, we went back home, or we brought this body out, or we bring this body out, or these elderly persons who couldn't come on their own, or we encourage these young teenagers to come out and make sure we come with them to make sure that they don't walk away, because they need to know is important. That's the kind of interaction that we want from the country. And if we get it, believe you me, in my gut, I know we will get it, and in my gut, I know we can overcome it by ensuring that we minimize deaths. I think, David, you started to do some of it on radio on Friday. But when we look at the number of deaths in Barbados, Barbados has an appreciably lower level of deaths than most countries globally. And I think that we have to give thanks for it. I'm satisfied it is because we took a decision to have a separate isolation facility, and that we also took decisions to quarantine primary contacts as far as possible. Delta threatens our ability to do that, and that is why later this week, when David and others in the Ministry of Health are completed, they will start the conversation with you about home quarantining, and in very, very few cases, home isolation where the risk is exceptionally low. So at this point, I just want to thank Barbadians and to say, look, the battle continues. But if we want to return to a level of normalcy, not the old-time normalcy, because I don't think anybody's going to see that again, but a new comfort level where we want to be able to remove the restrictions, where we want to be able to reduce them and remove them, where we want to be able to earn as we used to before, or go out where we used to before, then we really need to make sure that when COVID attacks somebody, that the person does not die from it, or that the person is not seriously hospitalized. If we can be assured of that for the majority of Barbadians, then we can see levels of economic activity return. We're not shutting down the country, but as I said, the slowdowns come because, as you heard from Dr. Ford last night, the medical professionals are under stress, and the nurses and the orderlies and all of them. And if we don't play our part to help them, then when we may most need them, because the numbers are gone, they will not be there to help us. So let's work this together. I've got every confidence that we can do it. Thank you, and stay focused, stay safe, and let us hope also that our prayers will continue to buttress us, but prayers without good works means nothing. Thank you.
And thank you very much, Prime Minister, the Honourable Mia Amor Mottley, the Minister of Health and Wellness, Lieutenant Colonel the Honourable Jeffrey Bostic, the new National COVID-19 Public Advisor, Mr. David Ellis. We were also joined by the Attorney General and Minister of Legal Affairs, the Honourable Dale Marshall, members of the media, and you for joining. Good afternoon.